I'd like to start by thanking Sam and the team for inviting me to speak today, and also for undertaking this hugely important piece of research. On reading the report, I was struck by just how many of us feel the same sense of isolation. So there was a great sadness at reading these shared stories, but also a validation of my own feelings. So I think it's really positive that this research has been commissioned and now published, and I hope that on the back of it, changes can be implemented and improvements made for patients. It was interesting to think about my own experience of waiting due to COVID disruptions, because as an endometriosis patient, I am constantly waiting for answers. I waited 15 years for a diagnosis. I've been waiting 30 years to find out how this disease is affecting my body and different organs. I wait every month for the pain to come back, and I've waited time and time again in A&E, only to be told that they can't see anything wrong with me because I have an invisible disease which can't be seen on scans. So, living with uncertainty and constantly waiting for answers is a huge part of living with endometriosis, and this has a big impact on our mental health and creates a lot of anxiety. So I do feel like I have the experience to talk about this. In terms of how it affected me, 2 weeks before my planned hysterectomy in April, it was cancelled due to COVID, and I think it's fair to say that this was really devastating for me, because it had taken a lot of courage and contemplation to make this decision. As a 41-year-old woman who hasn't had children, I hadn't made this decision lightly. And I was willing to go through with a hysterectomy in order to try and regain some of my life, which has been overtaken by the pain of endometriosis. Even though hysterectomy is not a cure for endometriosis, I was willing to take this risk. So mentally preparing for surgery for any surgery is difficult. Mentally preparing for a hysterectomy when you haven't had children had taken a long time to find peace with. So to have this pulled away from me at the very last minute was incredibly hard to accept, and I think what made me feel even more sad was just this there was no recognition from anyone about how I might feel about this. And then when things did start up again, I was told that my surgeon was shielding, so I would have to go on the back of another surgeon's waiting list. So to this day, I'm still waiting to go onto a waiting list. At the same time, I was also having investigations into my lungs, thought to be caused by endometriosis. I've been having various symptoms. So this all kind of went on hold as well. So it's taken a year, and 3 weeks ago I had a lung resection to remove abnormalities from my lungs. And last week I was due to get the results of the biopsy, but this has now been delayed by another 6 weeks because they have sent the biopsy to a different pathologist to get a second opinion, because they believe that I have a very rare form of lung disease, which is either a primary condition in itself or has been caused by old endometriosis in my lungs, which has created some scarring. So I think, not only do things need to urgently improve for people with endometriosis, but it's also really important to recognize the pain and anguish which is caused by the waiting process for all patients. Feelings of isolation and worry due to the uncertainty of it all can become quite overwhelming, especially when this is compounded with pain. And so I think this in turn, and also when you are made to feel like you've been forgotten in the system because no one's communicating with you, you begin to feel a bit worthless, like you're not important. And you also have to become a bit of a project manager to make sure that different departments are speaking to each other, and to make sure that you're still in the system, because it feels like you have just been forgotten. So waiting has a huge impact on our mental health. I think living with uncertainty is incredibly difficult and shouldn't be underestimated. And I think it's really important that patients are given access to decent pain relief, physiotherapy, psychotherapy, anything that can help them and would be beneficial during this difficult time. And I think the importance of clear, regular communication from the healthcare provider is vital. And I think finally, I wanted to say that I can't help but compare the treatment I experienced when I was diagnosed with a bone tumour 10 years ago. Luckily, it was benign, but the urgency, care and support that I received at this time is in complete contrast to how I live my life with endometriosis. Endometriosis is not seen as life-threatening, though with the news I received last week and the deterioration of my lungs, if this has been caused by endometriosis, then I would absolutely put this into question. Endometriosis is often referred to as a benign cancer because of the way it travels around the body, but again, because we don't receive enough funding, there's not enough research, and so we just don't have any answers to know if this is in fact true. But to compare the two diseases, there is a huge disparity in the way patients with endometriosis are treated and the uncertainty that they live with. So I think despite the global health pandemic, which is obviously very difficult for everyone, and it is an incredibly difficult time, patients with these kind of chronic health conditions are continually suffering. And so, as a patient with endometriosis, I will continue to sit and wait for improvements to be made and to find out answers for how this disease is affecting my own body and the longer term health implications that this has on my life. And I hope that things will improve soon. Anyway, thank you for listening.